It is a huge, huge honor to be interviewing my first guest from Nigeria.
Yes,
I
the
mean,
honor is mine, sir.
Anoziem Ohiaeri.
Yes, yes, you're right, sir.
And you're from Nigeria, where my first idol and role model in dentistry is from the capital of Nigeria is the largest country in Africa. They got
Yeah,
173 million people. It's half the size of the United States. What a huge
yeah,
country!
a
Uh,
huge
and
country.
and the biggest city is Lagos, where my teacher is from, and the capital is Abuja. And where are you from? And are you?
Um, okay, personally, I'm from Imo State. Imo State is in the southeast of the country. All right, and currently I'm in Abuja, that's the capital city. I work at Federal Medical Center as a Nasarawa State. That's a few kilometers from the capital city. So I was able to come over here and have the Skype
Now, now,
interview with you.
Now remember, 84% of my audience is from America, and the
Okay?
16% is from 206 countries. And Americans, they don't know what a kilometer is. They only know they
Okay,
only know
they
what a
only know my.
gram is. They only know what a gram is if they used to do drugs in college. But if they didn't do drugs, they don't even know what a gram is. But basically, I got to tell you, I was so excited to have you because my favorite teacher in dental school was Bamidura Oguntebi, and he was from
Okay,
Lagos, Nigeria. His wife Cami, and they had three kids: Deji Boy,
okay.
Falaka, and Coco.
Yeah,
And he
yeah.
was the greatest endodontist in the world because he, back in the day, remember this is before the internet. When I got out of school, there was no
Yeah,
internet, there was no
yeah.
computers, none of that stuff. But
Because,
being from Nigeria, he studied endodontics from thinking from Japan and Korea and
yeah,
Germany and the whole world. Whereas most people learn everything their gurus taught them inside their own country. Most all
okay,
dental journals are only within a country. There's almost no dental journals read anywhere around the world. So everybody's in their own country drinking their Kool-Aid. And I'm sure
yeah,
that 86% of Americans are just tickled to get to
yeah.
hear someone
Okay.
working in dentistry in Nigeria,
In
Africa.
Nigeria,
So
in
so
Africa, yeah.
so tell us about yourself, your story, how you got into dentistry and what it's like working in dentistry in Africa.
Okay. Like you introduced me, my name's Anoziem Ohieri. I'm 30 years old. Um, I'm from Imo State, Nigeria. I practice as a dental therapist, which is like a dental hygienist plus some extra duties. I work at the Federal Medical Center, Kefi, Nasarawa State. It's approximately 40 miles from the capital city, Abuja. All right.
You're so
So
sweet converting that to miles for us
yeah, I had to
ignorant
do that.
Americans.
I had to do that. Okay, so how did I get into dentistry? Well, as a 14-year-old, I had a neighbor who happened to be a dental technologist. So one day I saw him boiling out wax from a flask. She was trying to pack the acrylic in, and I was like, excuse me, sir, what are you doing? He says, I'm making artificial teeth. And I asked him, it looks so interesting. How do I get to learn how to do this? So he told me there was a school, it's my alma mater in Enugu, Nigeria, southeastern Nigeria, Federal School of Dental Technology and Therapy. So after my O levels, I took the entrance exam and I got in, originally to study dental technology, but I eventually changed my mind and I decided to study dental therapy, which was more clinically inclined as against working in the laboratory. Though I still liked the idea of being a dental technologist, but the dental therapy job seemed more appealing to me. So that's why I chose that. And I got into Federal School of Dental Technology in 2002, approximately 2002, and I studied for 4 years, graduating with a Higher National Diploma in Dental Therapy. And I went to after that I did my internship, and from there I started practicing in a couple private practices, then did my national service, and after about 10 years, 7 years, I found myself in Federal Medical Center, Nasarawa State. So that's where I am till date. Yeah.
So, since most of our viewers have never been to Nigeria, tell us about what dental decay is like. I mean, would you say Nigerians have a high sugar diet with lots of cavities, or I mean, does the average 6 year old child have a cavity, or five, or not really have a cavity? Is
Yeah.
sugar a big part of the diet? What is the diet like in Nigeria? Would you say it's a healthy diet? Mostly fruits
Yeah.
and vegetables, or is it just a lot of packaged food and carbohydrates and sugar like it is in
Yeah.
America?
We're getting to the packaged foods and carbohydrate parts. We consume a lot of refined carbohydrates nowadays. But if you go to the rural areas, the diet is still very natural, so incidence of cavities is still very low for kids, but it's rising with the change in diet. We're adopting a lot of the Western style, takeaway, fast food, packaged meals and stuff. So we're getting to that point where you see a lot of young kids below 5, sometimes having cavities. Yes. So
So do you is it obvious to you? I mean, can you really see obvious in rural areas with a more plant-based natural diet, less cavities
yeah,
and see more cavities in large cities with more
yeah.
packaged food? Can you really is that really obvious or
It's not so obvious, but it's significant if you've actually gone into the field. Like I did once, we went for an outreach program in a place called Nasarawa, in Nasarawa State. So the kids we were dealing with were from the local community, and what we saw was just we only recorded about, let's say, 10%. Let me approximate because I don't have the figures here. About 10% incidents of cavities. The rest were just accumulations of tartar, stains, very little periodontal disease or gingivitis. They generally had very healthy teeth. Yeah, the kids. And we saw kids between the ages of 4 to 13 years old. So it was good. We didn't have so much problems. The kids who have the most problems are the kids you find in the urban centers. Who high income tend to eat a lot of processed foods and but the main problem here in Nigeria it's the problem of prevention and awareness, because a lot of Nigerians don't really know that they should see the dentist. So mostly they come to see us when they have pain. So it's a symptom-based treatment seeking kind of behavior we experience here. So if there's no problem, there's no need to see the dentist. That's the way it works here. Yeah.
I did a I went and worked in an orphanage in Tanzania, and
Okay.
it was at the base of Mount Kilimanjaro. Then after the orphanage, we went and did climb Mount Kilimanjaro. I swear to God, that was the
Yeah.
most beautiful place I'd ever seen on earth.
Yeah.
I mean,
It's
the
beautiful.
Serengeti. Oh my God, that's better than watching a Star Wars movie. To just think that that still exists out there. I mean, it was
Yeah.
just
Exists.
all we did for 3 days. Like, oh my God, I can't believe it. I can't believe it. I can't believe it.
We
But
have
the one
beautiful
thing,
places in Nigeria too. We have beautiful places.
well,
Beautiful
I
places.
cannot wait to lecture someday in Lagos. I would absolutely love to come lecture in Lagos and spend time there.
Yeah.
That sounds like a blast. But the point that I left home with when I left Tanzania is how low the decay rate was compared to
Yeah.
America. And
Yeah.
the other thing about America, when we talk about water fluoridation or fluoride in
Yeah.
toothpaste, everybody's talking about fluoride. Well,
Yeah.
Tanzania has a very high amount of water of fluorosis, and it's all natural. It's all from their lake
It's all
water.
natural.
Their
Yeah.
lake water is
We have
very high
fluorosis here too.
in fluoride, and it's not like I didn't measure it, so I can't say, but from going
Yeah.
around to 50 countries, I would say it's probably about 4 part per million fluorosis. It's a
Yeah.
good solid dose of fluorosis. And
Yeah.
gosh darn it, those kids, okay, so they got some little fluorosis on their teeth. They didn't need
Yeah.
pulpotomies, chrome steel crowns. They
No,
didn't
no,
need
no,
a bunch of
no.
decay. And when people are telling me about fluorosis, which can easily be whitened out with bleaching, sometimes you just
Bleaching
take a disc on a tooth and smooth it out or whatever.
and smooth it out.
But
Yeah.
fluorosis, I mean, there's not a kid in the world who would trade fluorosis for a pulpotomy and a chrome steel
Well
crown.
done. Yeah.
I mean, you
Sure.
literally got to be not right in the head to be worried
Yeah.
about fluorosis, because the countries and the air, and by the way, the ocean is 1.4 part per million. We just
Yeah.
add fluoride to community water fluoridation at half that amount, 0.7.
Have that amount.
But
Yeah.
northern Arizona's got a city of
Okay.
44 part per million natural fluoride in the water, 44 part per million. And their teeth are
Yeah.
all heavily fluorosis, and everybody doesn't have dental problems.
Everybody does have their
I
problems.
mean,
Yeah,
I mean,
we have a city in Nigeria called actually is in the northeast, where you have the Boko Haram problem going on now. Maiduguri, you should have heard of that if you've heard of that in the news. Maiduguri has natural occurring fluoride up to 15 parts per million, from their groundwater sources. So they have a lot of fluorosis there. I worked there. I did my national service there for a few months, and I noticed that they had very low incidence of dental decay. And the only problem they had a lot of gum disease. So where there's no decay, they had a lot of gum disease. So I had a lot of people with tooth mobility, and most of these people were, they were immunocompromised anyway. Most of them had HIV. Some of them had, So I think that could have had a part to play, in tooth mobility and some other stuff I noticed there. But all in all, they had very good the dental. They didn't have any. They had very low incidences of dental decay. Some other parts of the country, it varies. Nigeria is a very big country. In some parts, they have. It's huge. I mean, it's huge. Abuja is. Let me put it in miles. Abuja is about 600 and something miles from Lagos. Okay. And from Abuja to Maiduguri, where I served, is about 700 and something miles. So it's a big country, and the distribution of fluoride it varies from point to point. So in some places you have, really high, in some places you have normal, and in some places you have really low. But, we haven't really had a lot of studies that have, covered, we have like some shortages in research. So I can't say for sure, whether research has been done in some certain areas, but I think there's a research that was done, sampling the distribution of fluoride in the country. Yeah, something like that. So it's interesting, yeah.
So you just mentioned HIV. What is the HIV status of Nigeria or Africa these days?
Yeah, well,
is it getting worse? Is it flattened out?
No, it's not.
It declining?
It's I think it's on a plateau now because there's a lot of awareness. We have a lot of non-governmental organizations working on, creating awareness, prevention, then managing clients or patients who have HIV. We have a large HIV clinic in my hospital where people come to take their drugs. So there's a lot of awareness. So I think it's not progressing as rapidly as one would say, But in areas with crisis, I would imagine that it would be difficult to reach such places, like places in the Northeast where there's some crisis. I think there will be some increase, maybe due to the lack of professionals around there to continue creating awareness and managing the existing patients there. So that may be the problem in such areas, but in the rest of the country, it's all peaceful and safe, and people are going about their normal businesses and taking their, if they're ill, they can access medical care, without any problems. Yeah.
Yes, Africa is so diverse. Africa has 1 billion people, which is the same size population of North and South America combined. North and South America is 1 billion. Africa is 1 billion.
Yeah.
And you could take the entire United States of America and set it in the Sahara Desert, and there'd still be sand all around it.
All around here, yeah.
Moly,
Africa is large.
So what percent of Nigeria is HIV positive, would you say?
I think it's very low. It should be. I'm just guessing. I don't have figures with me. I'll say less than 10%.
Less than 10%. You said two interesting things. You said that HIV was more prevalent where there wasn't a lot of people walking around in a public awareness campaign.
Yes.
And then so obviously the public awareness campaign has brought down HIV. I mean, everybody's been talking about it. And countries that had a big problem talked about it even more, and that's what turned it around. But you also said that a lot of people don't go to the dentist because they're not aware of it unless they're in pain. And what I find funny around the world, you know, in my country, it was illegal for dentists to advertise until 1973. And in the
Yeah.
world or today, in many countries, it's still illegal for a dentist to
It's still
advertise.
illegal. Yeah. It's
Yeah,
illegal. In
it's
Nigeria,
illegal.
it's
Yeah.
illegal. Yeah.
So, I mean, that's just completely crazy because
It's
if the
crazy.
dentist, the more the dentists advertise, the more
Yeah.
their people come and give them money. And what are they buying money for? They're not giving money for packaged food and carbohydrates and
No,
Coke.
no, no,
They're
no.
getting money for healthcare. And
For healthcare.
at the end of the day, I don't care how many luxury items you have. The ultimate
Yeah.
luxury item is not dying, or in our
It's not dying.
profession,
It's good health. Yeah.
good
I
health.
agree
I
with
mean,
you.
health is wealth. I'd rather be
Yeah.
a peasant and live to be 100 than be a
Yeah.
billionaire and die at 40. You know what I mean?
And
And
yeah, I understand.
so it's just I hope our international listeners, if you're a leader, you got to write to your dental boards and societies and say, you know, look,
Yeah.
we brought down AIDS from public awareness, advertising, marketing,
Advertising. Yeah.
billboards, radio, TV,
Yeah.
whatever you want to call it. And if you can't, I mean, I can't believe Hong Kong. I mean, you would
Yeah.
think that's one of the most advanced civilizations on earth. And a dentist
Yeah.
does advertising there, he'll lose his license. It's just,
You
I
lose
mean,
your license.
it's
Yeah.
just like that. I just don't get it. So, so you're so young. I mean, you're only 30. I can't even remember when I was 30. I'm 53. I think I can only remember till last Thursday. I don't even know what I ate for
Yeah.
dinner last night. So you're so young. Do you think you'll eventually be a dentist, or are you very happy with being a dental therapist?
I would love to maybe do a master's degree in something related to dental hygiene or dental therapy because I had a passion for teaching. Yeah. But if I get like a scholarship, I could study dentistry, but I won't want to do that in Nigeria. I'd like to have a feel for it somewhere else. But my main plan was to do a master's degree in something dental related, then maybe progress to a PhD, then eventually retire to my alma mater to teach. Yeah.
And what would you like to
That's
teach?
I'd like to teach instrumentation, maybe perio. I like instrumentation. I like perio. I like pedo. So those are the three things I'd possibly teach.
Well, and what do you mean by instrumentation?
Instrumentation, as a dental therapist, you know, we use a lot of you call them curettes, scalars, curettes. You know, I'm a very tall person. I'm 5 foot. I'm 6 feet 5.
Are you
Yeah. So
serious?
yeah, I'm 6 foot 5. So
Wow.
everything, yeah, everything as the equipment don't fit. You know, gloves don't fit. The instruments are too small for my hand, so I had to improvise. You know, find a more comfortable way of walking without any detriment to my health because I suffered from a lot of musculoskeletal injuries. So this led me to develop my own technique of walking. You know, I unlike what we're taught in school to take intraoral rests, I concentrated on taking mostly extraoral rest because I have really big hands. So these are the things I liked about instrumentation. I'm really good with my hands. You know, I've always been very good with tools and that. So I was pretty good at instrumentation while I was at school. Then coming to the aspect of pedo, I love to do non-surgical periodontal therapy. I do a lot of curettage. I do a lot of deep cleaning. I do that
On
very well,
children?
and I like no, not on children, on
Okay.
adults
Okay, adults.
mostly. Yeah, adults. Yes, yes. Mostly adults. Yeah, children don't really have it that bad. You know, it's just clean around, just get rid of the tartar and plaque around visible. You know, so that's part of why I enjoy about those two things. And I love kids. You know, I find it a big challenge to get a kid to accept you and allow you to treat him or her. So that's one of the few things I like about
Well,
those
if
three
you love
parts.
kids, I'm going to give you all four of mine. I'm going to put them in an airplane and give them all to you.
Yeah,
Take them
no
all.
problem. Yeah, I'll
I'm
take
just
them. Yeah.
I'm just kidding. The only good thing about having children is that one day they bring you home a granddaughter, and that is your
Yeah, yeah,
reward for having children. My little 3-year-old Taylor is my reward for not killing
yeah.
all four of my boys at the same time. So you
Yes,
talk
yes.
about perio. Why do you
Yeah.
think why do you think you see a lot of perio in some of those regions that you were talking about earlier? What do you think's behind that?
I think I'll just put it in three parts. Maybe in a few parts I can say poor oral hygiene. Uh, Most Nigerians don't brush properly. You understand? Most of them don't have the basic skills of proper oral hygiene, toothbrushing, flossing, mouth rinsing, and all that. This is due to lack of awareness. That's one part. In some cases, you can attribute it to poor nutrition, and I think I'll just use those two,
Well,
as
the point
as a yardstick.
I guess I didn't. I should ask my question this way. When I go to China, I'm not in Hong Kong, but
Okay.
in mainland China, you see so much perio. But the joke is in China that every
Okay.
restaurant has two sections. They have the smoking section and the chain smoking section. There's not a no smoking section. It's just or
Yes, yes.
are you having a cigarette after
Smoking
dinner?
is also a factor, yeah.
Yeah. So is
Yeah.
smoke? What is smoking like in Nigeria? Is it like it is in China? I mean, I've read that the United States about 1 in 5 smoke,
Okay.
but at 1950 it was half. So in 1950 it was 1 in 2. Now it's down to 1 in 5. And again, to all you dentists who live in countries where dentists can't
Yeah.
legally advertise, what changed that? Changed that was government advertising, national
Advertise, yeah.
campaigns talking about
Yeah.
mouth cancer, oral cancer, and to
Yeah.
see how that took the United States from 1 in 2 smoking to 1 in 5, and then to have a country like Hong Kong say dentists can't advertise it's just not right. But what was is smoking prevalent in
Smoking.
Nigeria?
Smoking is prevalent. Yeah, I saw my last two clients on the Tooth Fairy project. These are my private clients anyway. Last two clients are smokers. I would say approximately 2 in 10 Nigerians smoke. 2 in 10. 2 out of 10 Nigerians
So
smoke.
about the same as the United
Yeah.
States, 1 in 5.
1 in 5. About that.
Yeah.
It's mostly with the younger population, those under 30. A few older people smoke. It's relatively common, but it's not as like prevalent like you find in China or Hong Kong, like you said. Yeah.
And why do you think the smoking is more prevalent in China than Africa? When I was in Tanzania, I didn't see anybody smoke. I
You
mean,
didn't see anybody smoke.
I mean, I didn't see it. I mean, you go to China, you can't see someone not smoking.
What happens is in Nigeria, you don't. Most smokers don't smoke in public. They smoke in gardens, in bars. So it's not like you see somebody on the street smoking. Smoking in public I think, is frowned upon. I don't think there's
Oh,
any
okay.
laws restricting. So it's frowned upon. People don't really smoke in public. People smoke in private. So you can't really see it like out in the open. But people do smoke a lot. If you hang out, if you go to the bars and clubs, it's all filled with cigarette smoke. So I may have to like review that 2 in 10. I can bump it up to 4 in 10 if I go to the club. I see a lot of people smoking. The whole club is filled with smoke.
So now,
You
so
know,
now
this,
everybody figured out I'm boring because I obviously
yeah,
didn't go to any bars or clubs when I was in Africa.
yeah,
I'm
exactly.
too old for that. Yeah, but
No, no.
huh.
Well, but you can go to open air, like here in Nigeria, we have this popular thing, we call them gardens, like green spaces where you sit out and drink beer, play board games, watch soccer, or we call it football here, the English Premier League and all that, have a good time. So it's in such places you find people smoking
I
and
want to tell
drink.
you what a Chinese dentist told me, and I want you to tell me if you believe it or don't believe it. He told me
Okay.
that the Chinese had such a massive prevalence more with periodontal disease because he
Okay.
said Chinese, Asians in general have a more constricted cervical neck. So the tooth comes down to a constriction more, and it really
Okay.
mechanically precipitates the calculus and the tartar buildup. Whereas he said Europeans were more in the middle, but he said the Africans had a more bulbous circular cingulum constriction.
Yeah.
And he said his pediodontist friends told him that chrome steel crowns snap on a Chinese kid because it goes into that undercut. Where he says a chrome steel
Okay. Yeah.
crown on an African child, oftentimes they come off because they don't have that tight cingulum constriction, and that's why they
Yes,
don't have as
constriction. Yeah.
much tartar buildup. Do you find that true in comparative anatomy? Do you think Asians have more tartar and more chrome steel crowns staying on because of a constricted cingulum net, and less so in the 1 billion Africans?
Yeah. I wouldn't know about the Chinese because I've not had any Chinese patients, but for tartar buildup, I think it varies with individuals. Even in Africa, you see some people with a lot of tartar buildup, you see some without it. So it's not like a fixed thing to say Africans don't have tartar buildup. Some don't have at all, while some have a lot. So your Chinese dentist could have a point, okay? He could have a point. Yeah, I
So
think he could
when
have a
you're
point.
doing, so you do fillings, then you do MODs, occlusals.
Okay, no, as a dental therapist, what I do basically here in Nigeria, I just do teeth cleanings, I do the curettage, I do temporary fillings once in a while, but under supervision. I do glass ionoma fillings, then I do pedo extractions. I do serial extractions for kids, all under supervision. We're not really allowed to do extensive, procedures on patients here in Nigeria.
So in your
Those
clinic,
rights are reserved for the dental surgeons. Yeah.
so in your
Yeah.
clinic, how many dental surgeons are there? How many dentists?
Okay. In my clinic, we have how many dentists? We have one general dental consultant. We have one maxillofacial surgeon. We have a periodontologist. Then we have about 18 dentists. Yeah.
And these 18 dentists, what is their most common restorative material? Are they doing their fillings mostly with amalgam, composite, glass ionomer? What are they mainly? What's their go-to filling material?
The go-to filling material for posterior teeth here is amalgam. Then for the anterior teeth, we prefer to use glass ionomer cement. Then sometimes we do composites. Uh, I think that's it. Yeah, amalgam, composites, and GIC.
And I always, I think amalgams are better. I think they're less expensive. They're less technique sensitive. They can be
Less
placed in.
expensive.
They don't have to have rubber dam complete isolation to last as long. But I've always
Yeah,
noticed that I've always felt, and I really feel I'm right on this, that Americans use the least amount of glass
okay.
ionomer. In Japan, where it's made, GC, General Chemical, Fuji,
Yeah,
Fujisem. Why do you think? So you're in the middle. You're probably, or you would you say you're in the middle? I'm looking at the map
yeah,
of the globe right now. You look about halfway between the United States and Japan. Do you
yeah.
do you think what why do you think Africans are using more glass ionomer from Japan and Americans use more composite from 3M and Ivoclar?
Well, we as Nigerians, we don't make any of this stuff, so we use the stuff that we use. Most of the materials we use based on what we find in the patient. It's not because it's from Japan or from the US. We're just right there in the middle. If you're presented with a patient who has a cavity on his molar, okay, we choose amalgam for its mechanical strength, its ability to withstand stress. If you put a glass ionomer, it might fail after a while, and our patients are notorious for not coming back. So we try to put something that can at least stay for a while. So that's why we choose the amalgam. Then in cases where some clients might request for filling that's white, hey, I don't want that black stuff in my mouth. You can either go for the GIC or the composite. So I think we're in the middle. We borrow from everybody. We use everything we can. I mean, anything that's available, because some of these materials are really expensive, and amalgam is relatively cheap. And being that I work in a government hospital, most of our clients are really poor. They can't afford expensive restorations, so we work with what we have. Yeah.
Yeah, half of America has a hard time affording the dentist too, so I totally understand that. Um, so you have 18 dentists and how many dental therapists?
Yeah. We have 6 dental therapists.
So not every dentist gets to work with a dental therapist. So there's just 6 dental therapists, but 18 dentists. So there's more dentistry going on than dental
Yeah,
therapy.
there are more dentists. What happens is the dentists are broken into sections. You have those in diagnosis, in oral diagnosis. You have dentists in oral medicine. You have dentists in periodontology. You have dentists in child oral health care. You have dentists in prosthodontics. So they do different jobs. So if you break it down, you just find about 2 or 3 dentists, or sometimes 4 in a different section. So we're 6 dental therapists. So what happens is if a client needs to have his teeth cleaned, if his oral hygiene is assessed and there's a need for scaling and polishing, the client is referred to the dental therapist. So the dental therapist does the scaling and refers back to the dental surgeons, like they're called here in Nigeria. And if if the client needs any prosthesis or appliance or anything, he gets an impression, is taken and sent to the lab. So we have the small departments, you know, in the dental clinic here in Kefi. Yeah.
So I was wondering, in Africa, is there any country that's considered like the dental leader? Like, you're in the largest country, Nigeria. Then the second largest
Yeah.
is based on population would be Ethiopia, then
Based
Egypt,
on population.
Congo,
Yeah.
South
Yeah.
Africa, Tanzania,
Yeah.
Kenya, Algeria,
Yeah.
Sudan. Is dentistry pretty much the same throughout those 10 countries, or do you guys consider one country more a leader that has more African congresses that dentists from other countries go to that country? Who's the leading thinking, educating country in Africa where most dental meetings go? Like, for instance, in Europe, the biggest meeting by
Okay.
far is Cologne, Germany. Everybody goes to Cologne for the latest, greatest
Okay.
stuff. Where's the Cologne,
Okay.
Germany of Africa?
Hmm. I think I'll break it in. You have Nigeria, you have Egypt, and you have South Africa. I'll just put
Nigeria,
those three
Egypt, and South
those
Africa would
three
be
countries.
the three leaders.
Yeah.
Yeah.
Yeah, but I'll personally give it to Egypt because they have a lot of good dentists there. I've read a lot of material coming out from Egypt. I see a lot of their stuff online, research and all that. So I'll give it to Egypt. Then maybe South Africa and Nigeria, I'll give them a tie.
Give
Yeah.
them a time. Yeah,
So
I
we have a
see.
lot of conferences yeah,
I
a
do
lot of
know the one.
conferences in this.
I do know the one thing Egypt is very good at is marketing their courses as a destination resort. I mean, people want to go there on vacation, see the pyramids,
Yeah,
and take river boats up
yeah,
the river,
yeah,
and then take course on the side. So yeah, they kind of got that tourism dentistry thing going, and with a lot of great information.
yeah.
What do you, since 86% of my audience are Americans, what do you think Americans would find interesting or don't know about?
Okay, Nigeria. Well, just you just have to put us a few years back, but it's pretty much the same, the only problems we have, like I said, were the fact that we don't advertise, and in that sense, we have very little awareness. So we're still working on creating awareness. Like every time I'm at work, I always get first time visitors to the dental clinic. We get that every day. I've never been to a dentist. I've never cleaned my teeth
And
before.
how old would they
We
be?
have a lot of these people.
How old would they be?
How old? They'll be the oldest client I've had who hasn't visited the dentist was 78. Yeah,
Wow.
78. She had remarkably good teeth. She just had a few. She had a lot of gum recession. She had a few.
We'll talk about
She had tartar.
what kind of advertising were the AIDS awareness, HIV people? What were they doing? Were they doing radio, TV, billboards, pamphlets,
Yeah,
handouts? What were they
yeah.
doing? What do you think was the most effective with them?
They did everything with the HIV campaign. They did radio. They did TV, leaflets. They did uh, shows, dramas, and all stuff. They did a lot with the HIV campaign. Same for malaria too. All those get a lot of airtime and all that. But dentists, no, we don't do any advertising. We only organize maybe free clinics, where we go into the community and we create awareness by, doing free examinations. We do school visits. Sometimes I get on the radio and talk, but not in the form of advertising. I just talk about, hey, this is the way you should brush your teeth. These are the kind of toothbrushes you should use. You should see your dentist every 6 months, or at least once a year, that kind of thing. So sometimes I get on the radio to talk. Sometimes I talk to friends, in my own little way, creating the awareness. Yeah.
I think it's amazing how I every time I've ever seen a study that says humans killing humans in war for the last 100 years, average
Yeah.
humans kill about 200,000 other humans per year on a 100-year average, but the mosquito with
Oh,
malaria kills a
yeah.
million people a year.
Okay.
So mosquitoes
Of
kill
course. Yeah.
5 times as many people as humans killing other humans. Do you worry? Now, I'm sorry to
Yeah.
be ignorant, but do you worry about mosquitoes and getting malaria?
Well, I've had malaria so many times I can't count.
Oh my God. Okay, so
You
tell us
get
about
malaria.
malaria because it's not a disease here. We're gonna have to wait for some more global warming. We're gonna have to wait about another 10, 20
Yeah.
years of global warming before the malaria belt on planet Earth gets big enough to get to Phoenix. But so you've
Gets
had
big enough to
malaria.
get to you. Yeah.
So what is that like? What is the
Yeah.
treatment for it?
Yeah. The current, I've had malaria, of course, multiple times. I think the last episode I had was about 4 months ago. It comes with the insane headaches. You have pains around your joints. You feel lethargic. You feel nauseous. And but as an older person now, the symptoms are less. It was worse when I was a kid, but now I'm grown up. I just have milder symptoms. But I'm still able to go to work. But
So
when I take the medication,
it's a
yeah.
virus, not a bacteria? Is it a virus or
It's a
bacteria?
protozoa. Is a
Protozoa?
protozoa.
And that
Yeah,
is
protozoa.
what is a protozoa definition? Is that a
The
single cell
protozoan is
bacteria?
let me get it. I just skipped my head. Oh my God.
Fung-
How did that? It skipped my head. But it's a protozoa. It's
Google protozoa.
yeah. Just Google it. It's
Not a fungus.
Plasmodium falciparum. It just came to me. Plasmodium falciparum. That's the name of the protozoa.
Okay, I'm looking at it right now. That is a interesting looking. And so
Yeah.
you're saying that you kind of develop um, it's a protozoa or a diverse group of unicellular eukaryotic
Yeah.
organisms,
Yeah.
defined as a single cell organism with animal-like
Yeah.
behavior such as motility and
Yeah.
predation. So
Yeah.
you develop immunity to it. So you're saying that after you've got it a dozen times, it's not as severe.
Yeah. It's not as severe. Yeah. It's not severe
And do you
as
know?
it.
I mean, have you had friends and family die from malaria over your lifetime?
Nope. No friends, no family has died from malaria.
So
So it's
when it's killing a million people a year, would that just be rural areas, not without access to?
it kills. Yeah, not even in the rural areas. It's not as the deaths are usually from the most vulnerable people are usually pregnant women and newborn babies. Those are the most vulnerable people.
Really, a
Okay,
pregnant woman is the most
who they
vulnerable?
make up most of the statistics.
Pregnant women and
Yeah,
babies. And
pregnant
I wonder why a pregnant woman would be
and their
more
babies.
susceptible.
Yes.
Huh, I never would have thought that. I mean, I would assume infants and elderly. I mean,
Yeah.
I figure a 1-year-old and an 80-year-old would be the
Yeah.
most vulnerable to any illness, but a pregnant woman is more
Uh,
vulnerable to death from
pregnant
malaria.
woman. Yeah. Yes.
Huh, and why is
Yes.
that?
More vulnerable. And I think that there's been some studies to show that there's been malaria adversely affects pregnancy. So I'm not an expert in that field, but during the period of pregnancy, the woman is more susceptible to malaria, and if she has malaria, it affects the stages of pregnancy and all that. So during the antenatal visits, women are treated for malaria and given insecticide-treated nets to prevent them from having malaria and causing adverse effects during pregnancy. So it's more of a preventive thing. That's the focus. The focus is on young infants and pregnant women.
So does at your house, do you sleep in under mosquito nets?
On the mosquito net? No, I have nets on all my windows. Okay, so what I do is I fumigate my house like once in 2 or 3 days. Make sure I kill all the mosquitoes, and I don't have any problem. Yeah. And then I keep my surroundings clean. I make sure there's no stagnant pools because, if you have a stagnant pool of water, that's where the mosquitoes go to lay their eggs, and, so just make sure your surroundings are clean so you have less mosquitoes around you.
You know what's interesting is I live in
That's it.
Phoenix,
But it's
Arizona,
recommended that people, yeah,
and it's a
I bet
desert.
you don't have mosquitoes there.
Well, exactly. Interesting. When I
Okay.
moved here in '87, it was mostly desert landscaping, and there were no mosquitoes or flies. And then the
Yeah.
30 years I've been here, all they've done is
Yeah.
built golf courses and man-made lakes and all this stuff. And now I'm eaten alive by
Yeah.
mosquitoes. There's golf courses, lakes, and there were so many of us screaming back in the day saying, if you want golf courses and lakes and all that
Yeah.
stuff, go back where you come from in the Midwest. Go back to
Okay.
Kansas and Iowa. But
But
they made it look just like
yeah.
Kansas, and now there's mosquitoes everywhere. So if those things ever did get malaria, it'd be an issue.
Oh,
Because
you
it's
don't get malaria, do you?
no, we don't get malaria, but
Do you get malaria there?
no, I don't know why.
No. Okay, that's good. Yeah,
I
it's
don't know why
nasty.
our
You
mosquitoes
don't
are
want to have
everywhere.
that stuff.
Yeah,
I was going to put this up like we are somewhat disconnected from the rest of the world when it comes to dentistry. I've noticed that dentistry is compartmentalized, and there's dentistry in this country, there's dentistry in the next country. So I was thinking of partnerships. Great minds such as yourself. You know a lot of professors, doctors. I'm sure they're itching to do something good in dentistry all around the world. So they could partner with our schools and educational systems, to give us like the right kind of training or extra training, or get us up to date with the latest happenings in dentistry. I was fortunate to be introduced to Dental Town or Hygiene Town by a friend who used to get subscriptions, magazines back in the day. So that was where I started getting, new research, ideas about what's happening in dentistry and all that. So we need partnerships, exchanges, people going to study, bringing back this knowledge and using it to develop our own dental profession here in Nigeria.
you know.
I think
Well,
that's,
first of all,
yeah,
Dental Town's been out since 1998, and every single time any
yeah,
dental school ever got on the message boards and says, is there any chance any of you American dentists would come over here to Albania, any of these countries, and teach
yeah,
a course on root canals or implants or whatever? And every
yeah,
single time they get a volunteer who says, I'll do it. I mean, American dentists love that stuff. If you got on Dental Town, and
yeah,
there's 53 sections, there's fillings, crowns, root canals. One of them's
yeah.
international
I
section.
know.
If you went to Nigeria and you
Okay.
posted, you said, we would really
Yeah.
love to have an endodontist come over here or a pediatric or whatever. Oh my God, they love
Okay.
it. And
Yeah.
and that's why I
Yeah.
started digitizing all those courses on Dental Town. And we're going to have those
Okay.
available
Yeah.
on your smartphone. How's the internet speed on Dental Town compared to other websites in Nigeria?
The internet speed here is really bad. I had to leave my station to come to Abuja to use a friend's internet in his office. It's really fast. If I was in my station, I wouldn't be able to talk to you as smoothly as we are talking right now. So,
But is Dental Town
but on my
about the same performance when you're on the computer
yeah,
as
it's
other
yeah,
sites?
yeah,
Does it
yeah. It's the
perform?
same performance.
Because
Same,
some
yeah, same
consultants are
performance.
telling me that I need to move my data bank over to the Eastern Hemisphere to increase performance time. We're looking into that now. But you think the performance on Dental Town is
Yeah.
good?
The performance for us here in Nigeria, we have really slow internet here. Our internet is not as fast as you get in the US or in Europe or in Asia. So for our own level of internet performance, Dental Town opens just fine for me. It works just
So
fine. I use Hygiene Town mostly.
have you told the 18 dentists that work in your facility about Dental Town?
Yeah, I've told quite a few of them.
You,
Yeah,
you know what
a
will
few of them are aware of this.
you know what would really help for SEO,
Okay.
if you go to my podcast on iTunes or you go to it on
Okay.
YouTube and you write a review,
Okay.
it really helps the
Okay.
SEO. In fact, all my listeners out there, I would give anything if you'd write a review, because like if you wrote a review from Nigeria and a Nigerian was
Okay.
searching dentistry on iTunes or Google or whatever, they'll
Yeah.
start they
Yeah.
point them to where the reviews are. So
Yeah.
if you could write me a
Okay.
review from Nigeria, that would help me get
Okay.
into 1 billion people in
Yeah.
Africa. That would be great. And if there's
Yeah.
anything
Um,
that you want to do a partnership with Dentaltown, if there's any
okay.
ideas or dreams or fantasies you have about a
Yeah.
partnership or working together, just
Yeah.
get on Dentaltown, start your own thread, and say, I am
Okay.
Anoziem Ohiaeri, and I am a dental
Yeah.
therapist from Nigeria, and I wish
Nigeria. Yeah.
this. And I swear to God, I remember. I mean, people have asked for used equipment. I mean, there was one. I was in Tanzania, and I went into a dental office, and I was talking to this woman dentist who was all dressed up in her veil and sorry, and I could just see her eyes. And
Yeah.
I asked her, I said, what's your biggest dream or fantasy in dentistry? And she said, someday I want an X-ray machine. So she posted it.
Wow.
So I took a picture of us, posted on
Yeah.
Dentaltown, and in 1 hour,
Yeah.
a dentist from India and two different dentists from the United States said, I'm shipping you my X-ray unit right now. I just put in a new one,
Yeah.
and I've had this other one sitting in the back
Well done.
room for
Sitting in the
whatever.
back
And
room. Yeah.
and then it was so funny because then she told me, she goes, now I feel bad because I have three. And I said, well, then sell the other two and keep the money. And
You keep the money. Yeah.
so, in life, we don't get what we deserve. We get what we
Yeah.
negotiate. So if you have a
Negotiate. Yeah.
dream,
Yeah.
dental dream, whatever, just post it on Dentaltown, or you can email it to me, howard@dentaltown.com. How could,
Yeah.
if somebody wanted to reach out to you, how can they reach out to you?
Okay. My email address. I have an email address. My email address is aohieri@gmail.com.
Spell that
A
O'Harry. Spell A
Okay.
O'Harry.
AOHIAERI @gmail.com.
So that was AOHIAERI.
Yes.
Man, that's
Yes.
a lot of vowels in one name. AOIAE. You only have two consonants out of
Yeah.
nine.
Yeah. Yeah.
Uh,
Okay. So that's my email. Then I'm on Twitter at the Tooth Fairy.
and how did you get that name? I thought that was such an adorable name on Twitter. ZA.
Yeah.
What's ZA Tooth Fairy? What's the ZA stand for?
It's like it's like
The Tooth
like
Fairy?
like the Tooth Fairy, but
The?
in a like the way a German or Eastern European would pronounce it.
That's
The
what I
Tooth
thought it
Fairy.
was. That's what I thought. The
Yeah.
Tooth Fairy. And why the
The
Tooth
Tooth
Fairy?
Fairy. Yeah, a friend of mine, because I was always going from house to house doing cleanings. That's the Tooth Fairy project. Okay. Since a lot of my clients will not come to the dental clinic, I put together some money. I got a mobile dental chair, foldable dental chair, a foldable zero box with the suction and the slow speed hand pieces and the fast speed, and all that, the syringes and all that. Then I have my piezo ultrasonic scaler. So I have all that, so I can go from house to house and do cleanings. And once in a while, I get called out for community visits or programs where we do free health checks or dental checks. Then a few lucky people get to have their teeth cleaned. So that's the Tooth Fairy project.
And on Twitter,
Yeah.
he's at zatoothfairy.com. You got to go. Is someone talking to you?
Yeah.
Okay.
All right, yeah.
Well, I'll tell you what. Americans have big hearts. They love to share stuff. They love to
Yeah.
help. You start a thread on Dentaltown. You tell them what you need,
Yeah.
and people listening here. And I tell you what,
Okay.
you'll get what you want. Hey, thank you for being my first guest from Nigeria, Africa. And I just think you're adorable.
Thank you very much,
I
sir.
think you're amazing. I love your energy, your karma, your passion, your enthusiasm. It was an honor that you spent
Yes,
an hour
sir.
with me.
Yes, sir.
Have a great day.
The honor was mine, sir. Thank you very much.
Okay,
Yes,
bye-bye.
you too, sir.